The importance of social relations. Many of us ignored caution and spent the holidays with loved ones, engaging in enlightening conversations, offering hugs, suggestions, and encouraging words. An exciting and much-needed dose of human interaction after nearly a year of harsh social limitations induced by COVID-19. The COVID virus, however, unhappily did not disappear with the start of a new year, and we are urged to return to our new normal routine of mask use, social withdrawal, quarantine, etc. It seems appropriate to discuss the value of maintaining social connections and caring for our social networks despite the COVID pandemic, especially during the COVID pandemic. Why are social relationships important? Like most animals, humans have a social nature by nature. It is how nature works. Well, social behavior is even seen in ants. Even as humans, we have considerably richer and more meaningful social ties. They provide us with a sense of community, purpose, and support, and eventually, they improve our health and length of life. Many studies have demonstrated that people who enjoy satisfying connections with their family, friends, and neighbors are happier, experience fewer health issues, and live longer. Scientists have shown that social interaction reduces unhealthy levels of stress. Chronic stress may be harmful to your mental and physical health and contribute to a wide range of serious health issues, as most of us are aware. According to some studies, providing care for someone else may even cause the production of stress-relieving hormones in both the giver and the receiver. Strong social ties can have a positive effect on your health beyond reducing stress. We can pick up good practices from other people that help us take better care of ourselves. Then, of course, there is the obvious. In a nurturing relationship, both individuals typically have an interest in one another's health and happiness, as well as their own, because they want to be there for one another. Regrettably, a third of Americans do not have these solid social ties, which puts their health at a serious risk. The absence of social connections poses a risk that is comparable to, and in many cases exceeds, that of other widely acknowledged risk factors, such as smoking up to 15 cigarettes a day, being overweight, inactive physically, and breathing in pollutants. Professor of Psychology at Brigham Young University, Julianne Holt-Lustend, PhD. What are the health risks for people lacking strong social relationships? It is well known that prolonged social isolation can eventually lead to psychological and physical deterioration, and even death in healthy, well-functioning people. Individuals who don't have supportive, healthy relationships with others are significantly more likely to both anxiety and depression. Increased stress and inflammation can hurt the immune system, gastrointestinal health, insulin sensitivity, and coronary arteries. A variety of illnesses, such as cancer and cardiovascular disease, deterioration in mental ability and functionality, including dementia, decreased ability to fight infections, delayed recovery from a disease, accident, surgery, death before age 55. Social interaction with others is usually seen as a basic human need that is essential to both survival and well-being. Indeed, social isolation or solitary confinement has been employed as a kind of punishment, according to Julianne Holt-Lustend, PhD, Professor of Psychology at Brigham Young University. Extreme examples illustrate that newborns in custodial care who lack human contact fail to flourish and frequently die. Nonetheless, a growing percentage of Americans now routinely feel isolated. Why are so many people experiencing loneliness and a lack of social connection? There is an increase in social isolation, loneliness, and relationship stress. Before COVID, there was a terrible epidemic raging in the US, the epidemic of loneliness. According to a loneliness study by AARP, roughly 42.6 million persons over the age of 45 in the United States were considered to be suffering from chronic loneliness. Even more concerning is the uncannily identical loneliness numbers for teenagers and young adults. According to certain theories, the rise in social isolation and loneliness is caused by, over the past 50 years, the proportion of adults living alone has nearly doubled. Nowadays, there are more single-occupancy homes than ever before in recorded history, lower household sizes, a decline in marriage rates, and an increase in childlessness. Decreased interest in the community, as evidenced by a decline in volunteerism. A rising number of Americans say they don't practice any religion. Fewer face-to-face encounters required as a result of technology and social media. How can I build and nurture social relationships? You might be asking how to develop a strong social network now that you are aware of the significance of social ties to your physical and mental health. Here is a little advice. Start with existing relationships. Reach out to strengthen the bonds you already have. Simply pick up the phone or send a text, email, or card to get started. Turn your work colleagues into friends. Don't be hesitant to start a discussion with someone you think you might connect with at work if you have any inkling that you might. Look for other things you might have in common since you already have work in common. Look for opportunities to be social. Granted, although COVID has hindered some social chances, there are still ways to meet new people safely. You simply need to hunt for them. Participate in activities involving smaller groups if you don't feel at ease around a big crowd. Join a group. Find a local group or club that meets to participate in an activity you enjoy by thinking of one. If you're not yet ready to interact with people you don't know in person, think about joining an online community or organization that has similar interests. Volunteer. Meeting new people is made easier by volunteering. Also, volunteering has been shown to improve mood and lessen anxiety and depression symptoms. With the present COVID limits, you might not be permitted to volunteer at a hospital or senior care facility, but you could be able to do so at your neighborhood food bank, animal shelter, road or park cleanup, etc. Take a class. Investigate the classes being offered at your neighborhood library, community center, or college. Outreach if you enjoy learning new things. You might even enroll in a yoga class or another kind of fitness activity. You can connect with others who share your passion for self-improvement by enrolling in a class. Get a pen pal. If you like to write, you can connect with a person through a pen buddies organization like Soldiers Angels, Paper Bridges, and others, and develop satisfying relationships. Practice effective communication. Use social opportunities to the fullest by developing your communication abilities. Be friendly by grinning, making eye contact, and keeping an open posture. Bring individuals into the conversation by posing open-end queries, paying attention, and posing follow-up inquiries. Be sympathetic and encouraging. Discuss shared hobbies, anecdotes, and suggestions. And that's a wrap. We've delved into the importance of social relations and how they can impact our lives in significant ways. From discussing the benefits of having strong connections with friends and family, to explore the ways in which social isolation can harm our mental health. It's clear that cultivating positive relationships is crucial to our overall well-being. So, let's make it a priority to nurture our social connections and prioritize meaningful interactions with those around us. Whether it's setting aside time to catch up with old friends or making an effort to connect with new people, investing in our social relations is one of the most important things we can do for ourselves. Thanks for tuning in, and don't forget to like and subscribe for more content on living your best life.